First of all, I'm really sorry you and your family are going through this difficult new diagnosis. This is a lot to navigate, and I'm going to tell you what I would recommend to any friend or family member in the United States that reached out to me asking for a recommendation about where to be treated. There's two things about multiple myeloma treatment that I think are important to understand when you're trying to figure out where to get your cancer treatment. For patients that are considered candidates, which are most patients, especially patients that are younger than 65, the standard of care therapy currently is an autologous stem cell transplantation. The best way to get a stem cell transplant is at an NCI designated cancer center associated with a high volume transplant center. If you go to the National Cancer Institute website, you can find a list of NCI designated cancer centers, figure out which one is closest to you, and aim to get a consultation there. You can also go to the FACT website, the Foundation for Accreditation in Cellular Therapy, to look for a FACT accredited organization. The FACT is going to have a certain standard threshold for volume of annual transplants that, to be accredited, a specific institution has to meet. The other piece to understand about multiple myeloma treatment is that multiple myeloma treatment is a marathon, not a sprint. And the majority of treatments that we offer for the initial therapy for multiple myeloma require very frequent visits. Most of my patients will be coming into my clinic at least once a week during their initial therapy to receive an injection or an infusion. They also will often require frequent laboratory monitoring during the initial phase of treatment. If you're looking for expert level care for a multiple myeloma diagnosis, my recommendation is to find a good local oncologist who can manage the day-to-day care and then be seen in consultation at an NCI designated cancer center for both evaluation for transplant and to see someone that only does multiple myeloma. Another reason to be seen at an NCI designated cancer center is that there are many, many new multiple myeloma treatments that are coming out. They are not all available yet in first and second line setting, meaning the first or second treatment that you receive. But that could change, and there are some clinical trials available that may get you earlier access to some of these exciting new drugs. Now, some of this may be available through your community oncologist, and it's important to ask about that even when you're seen by a local oncologist in the community, someone like me. If you go to an NCI designated cancer center, they will in general have strong access to multiple clinical trials. I hope that helps and that you're able to put together the medical team that works best for you, depending on where you live and what kind of support you have.